Hello, primary care providers and physicians. We'll be going over the virtual visit process, first with the iPhones or iPads, then with a laptop or computer. On your iOS device, you'll need to go to the App Store. Once in the App Store, you'll need to search for American Well for Clinicians. It'll be a purple stethoscope icon. Click the download or get button. After you download the app, you will see the American Well app on your phone. Once you open the app, you will want to click Allow to get notifications. You will then enter your system name, which is IU Health Video Visits. Click Continue. You will then need to put in your username and password. This password is not the system password, it is what you created when you first signed up. You will then click Remember this username. This will allow you to use Face ID or Touch ID, so click Enable. This will come up for getting started and give you some tips and tricks for when doing virtual visits. You will then want to click Yes to allow notifications. You want to make sure that the unavailable is always on for your status. If it ever goes to available or ask me, you will be an on-demand provider. When you actually have a patient scheduled, you'll see one patient waiting in your waiting room. You will also get a notification on your phone when someone's waiting in your waiting room. You can then click on that patient's name. It will load information that you can review, any help with opening and closing statements. You can review anything from the health history that is on here, but you should be reviewing everything in Cerner and documenting everything in Cerner, not on the American Well platform. You click OK to have access to the camera if you have not already done that. You'll click OK to access the microphone if you have not already done that. And then you will connect with the patient. As you can see, it does take some time to load. It depends on your Wi-Fi connection. Your video will then load. You will be at the top of the screen. At the bottom of your screen, you can mute your sound, mute your microphone, or reverse your camera. At the top of the screen, you can ignore the minutes left. You'll have an hour and a half to finish any video visit. You can refresh your video with the arrow. And you can hang up the call with the far right phone icon. It is recommended that the patient hangs up from the virtual visit. Once you're done with your virtual visit, you will get a summary. If your visit is cut short and you need to call the patient, you can scroll down for the current phone number of the patient. You will not need to document anything in the American Well platform. You will only need to document in Cerner for everything. To do video visits on a laptop, go to the website www.iuhealth.virtualvisits.com. Log in the upper right-hand corner at Provider Login. Use your username and password that you created. It may not match your IU Health system. When you have a patient in the waiting room, it will look like this. You'll be able to see how many patients you have. You can ignore the wrap-ups that you have to complete or just click OK. It'll not take you away from the screen. You'll click Review and you can see all the information on the patient. You can see some opening and closing statements and any information in the chart. I then click Launch. This will launch your virtual visit with the patient. It'll load on your computer screen. You can maximize the screen on the right-hand corner square. Once the video connects, you'll be able to see the patient on the large screen and you on the lower right-hand corner. In the bottom left-hand corner, there are some things you can do: lowering your volume, raising your volume, lowering your mic, turning off your camera, etc. In the upper left-hand corner, you can refresh your video if you're having issues seeing your video or seeing the patient's video. On the right-hand corner, you can end the visit. It is recommended, though, that the patient ends their visit. Once you end your visit, you'll get to the review wrap-up screen. Here, there will be some notes, diagnosis. You do not have to fill this out. You will need to document in Cerner. You can submit the wrap-up and be complete and move on to Cerner. Next, we will review copying auto text. In Cerner, on the toolbar, you'll see the Copy Auto Text tool. You can search any user to copy their auto text. I searched Julie Godfrey, and if you scroll down, you can see all of the auto text she has. Click on the auto text you choose. You can see a view of what it looks like. Click Copy, click OK, and then you'll have to log out for you to be able to have this auto text. Next, we'll review adding the GT modifier that you need to add when entering your charge. When entering your charge, make sure to go to Modify Details. Go and click on your charge. Then below on the Details tab, click CPT modifier. Start typing in GT to add that GT modifier, and then sign, and you're complete with adding the GT modifier.